My name's Tammy Gaines. Today is the 28th of February. We're in Nursing 2 and I will be performing an NG PEG tube medication administration. I'm going to knock on the door. Hi, my name's Tammy. I'm going to be your nurse today, and I'm going to be giving you some meds through your PEG tube. Is that okay?
That's okay.
Okay. I've got all my stuff gathered together, and I'm going to get it ready. I'm going to check the order. I've got a ciprofloxacin, 250 milligrams daily. Metformin ER, 50 milligrams daily, which I will not be able to give by the PEG tube because it's extended release. And a carvedilol, 6.25 milligrams BID. And I'm going to flush with 10 mils after and before and with each medication. Let's see. So I have a towel, I have a tongue depressor to check gag reflex and stir the medicine. I have medicine cups, gloves, hand sanitizer, pill crusher, 60 milliliter graduated syringe, and my litmus paper. And I have water. So I'm going to get started.
Can you tell me about my meds?
Well, first I'm going to verify you. Can you tell me your name and date of birth?
Peggy Wilson, 2/30/2018.
Alright, and I'm going to look at your armband real quick. Okay, I'm going to provide some privacy real quick. And I'm going to raise the head of the bed and make sure that I have lights. And I'm going to put you up at high hours. Alright, is that okay? Are you still comfortable?
Yes, ma'am.
Awesome, thank you. Alright, I'm going to wash my hands and I'm going to get your meds together. And while I'm doing that, I'll tell you about your meds a little bit, okay? So, you have a PEG tube, and I'm going to be crushing your meds and putting them in the PEG tube with some water. I'm going to be giving you your carvedilol. That's a blood pressure medicine. It's a beta blocker. It's going to help bring your blood pressure down. Some things you need to worry about with carvedilol is you could have hypotension or thrombocytopenia, so you'll want to pay attention to that.
Okay.
If you start feeling dizzy, lightheaded, weak, please use your call light and get a hold of me, okay? And we'll rush in here. The other one you have is a ciprofloxacin. That's an antibiotic, and that's going to take care of any infections that you have going on, okay? And one of the side effects for that, you're going to notice it's pretty common, is maybe some diarrhea. So if you're having loose stools, we'll take care of that. And then one of the scarier things you could look for is tendon rupture. So if you have any pain in your joints, in your knees, your ankles, let us know, okay? And then we'll take care of that. All right, so I'm going to take your meds out real quick in a second, but I'm just going to assess you real quick and make sure that everything's in the right place. Is that going to be okay?
Mm-hmm.
All
That'll
right.
be fine.
I'm just going to listen to your bowel sounds for a couple seconds or a couple minutes. If I can get my stethoscope out here. All right. Bowel sounds are normal active in all 4 quadrants. Okay. And then I'm just going to check your gag reflex real quick. Can you open your mouth for me? Stick out your tongue, go ah, ah. And I'm going to put that in the back of your throat. I know that's not pleasant. Okay. Now the next thing I have to do is go ahead and hook up to your little tube here. I'm going to put a towel down first so that it doesn't get messy, or in case I pull this little syringe out on accident, so we don't have a mess, okay? And I'm going to see what kind of residual fluid you have in there. Okay. So I have less than 150 milliliters, so I'm going to go ahead and put it back. Oh, just kidding. I'm gonna pull that out again and I have less than 150 milliliters. I'm gonna check the pH real quick. And it is acidic, so it's stomach acid. And actually, I'm gonna listen to the bowel sounds when I put it back in. And I also heard the flush in the gurgle when I put that back in. So I'm gonna pinch off this tube, undo this, cap it back while I remove the plunger and get my medicine ready. Alright. Wash my hands again. I'll put new gloves on, but I lost those. Check my meds against the order one more time. And those match up. I'm going to put my medicine in the cup without touching it. Keep my labels with my medicine so that I know what's what. And then I'm going to check one more time before putting it in. I'm mixing up my medicine. Did you actually put medicine in? I would have gloves on, but I don't have another pair, so I'm going to pinch this tube off and hold it. I'm going to flush with 10 milliliters before any medications. Let that go in slowly. I'm going to do my first medicine, which is the carvedilol. Let that go in slowly. Flush with 10 milliliters of water. My second medicine. And then a final flush with 10 milliliters of water. I wasn't able to do the metformin because it cannot be crushed, so I'll have to call the doctor or the pharmacy and get another order.
What about
for
my
that
water pill?
I'll have to check on your water pill. Hold on a second. Looks like I forgot your water pill. Let me go get that real quick. I'm going to cap this off real quick while we're waiting. Yeah, I've got that too right here. Let me give you that real quick. This is your furosemide. It's a diuretic. What it's going to do is pull some of that fluid off of your body to help you with your breathing. Get some of that fluid off your lungs. that with 10 milliliters as well. Pinch the tube, reattach the syringe. That's mixed up well, so I'm gonna put it in there. Let it drain slowly. And then flush it with another 10 milliliters. Pinch that off so that no air gets in there, and let it go. And then I'm gonna assess for any asphyxiation, let her know that she's gotta sit up for at least an hour above 30 degrees so that she doesn't have any asphyxiation problems. And then I'm gonna lower the level of the bed. It doesn't work. I'm gonna give her her call light back. There's no call light, but I will give her her call light back. Assess that she's okay and not having any problems. Clean up my area. Perform hand hygiene. And then come back and reassess her at about 15 to 30 minutes for therapeutic effect.
Thank you.